For step 1 of our venipuncture, we need to get our supplies all prepared before we get started. So we have some gauze here and over the needle catheter, but for this video we are using a butterfly needle. We need some gloves and some alcohol prep along with a tourniquet. We could not find a tourniquet, so we just tied some gloves together. And then we need an arm, which is the most important part of the venipuncture. So the next step that we do is we make sure that our hands are clean, washed and dried correctly to make sure that the venipuncture is as sterile as we can be. And then the next step is to put on some gloves. To make the venipuncture more sterile. Next, we will look at the arm and make sure we can find a vein. And you saw him tapping on it, so to make sure that we have a good vein. And then we have someone putting on the tourniquet here. So you just tie it up, kind of like the beginning of a shoelace, and then putting it halfway through underneath the tourniquet so it's an easy access of taking it off when finished. Okay, so after we put on the tourniquet, we make sure that we palpate the vein to make sure that we have the right vein and it's a nice and good vein. And then the next step that we would do is apply the alcohol prep wipe to make sure that the area that we're going to insert the needle on is nice and clean. So with your non-dominant hand, place your thumb on the vein here that she has to help ensure that the vein does not roll when you insert the catheter. Next, she's going to slip off the cap of the needle here, and we do again have a butterfly needle here.
Make sure your bevel is up, the hollow point of the needle and the sharp point of the needle down, and go in at a 20 to 45 degree angle into the vein. Make adjustments until you see flashback.
So once the needle is in place, we do, as I mentioned before, have a butterfly needle here and not an over the needle catheter. If you do have an over the needle catheter, you would slip the catheter into place and then retract the needle. And then after we retract the needle, we would tape it up and also release the tourniquet here by pulling that tab, and then see how easily it came off of the arm. So once the patient doesn't need the catheter anymore, we would apply some gauze over the needle, and then we would slide out the needle. Make sure you apply pressure onto the gauze, and then you can apply tape or a Band-Aid, but you can put tape over the gauze there because they could be bleeding a little bit from the insertion of the needle.